Like the World Health Organization, the Assembly, the highest decision-making body of the WHO, is expected to adopt a draft resolution that, among others, calls for a collaborative effort in the development and licensing of safe, effective therapeutics and vaccines that facilitate equitable and affordable access to them.
It's the world's highest health policy setting body and comes at a time when societies are in the grips of a pandemic and where deliberations will be closely scrutinized.
What member states of the UN are saying, that they are immensely grateful to our president for giving leadership at a time when global leadership is needed, sorely needed. Our president, together with Chancellor Angela Merkel and President Macron of France and the Secretary General of the UN, including in a partnership including Bill Gates, were the first to say, as global leaders, we're in this together. We know it is frightening, we know it creates insecurity, but we best deal with this together.
The draft resolution, co-sponsored by the European Union and the Africa Group, calls for an intensification of cooperation and collaboration at all levels to contain, control and mitigate the COVID-19 pandemic, reiterates the importance of urgently meeting the needs of low and middle-income countries to overcome it, to provide the WHO with timely, accurate and detailed public health information, and to work collaboratively on a vaccine for all.
To have it in a resolution, you have to understand that to have it in a resolution in the first place, including language that mentions the WTO TRIPS flexibilities, is an incredible thing. Where the resolution is at, it's not going to be changed. That is language that is final and that is indicative of a consensus that was hard fought for, and developing countries were able to rally around.
As concerns mount about which countries might get an effective vaccine first.
In these extraordinary circumstances, we need to unleash the full power of science to deliver innovations that are scalable, usable, and benefit everyone, everywhere, at the same time. Traditional market models will not deliver at the scale needed to cover the entire globe.
While the issue of Taiwan's observer status to the WHO will again come under the spotlight, a region thought to have had one of the best public health responses to the outbreak, seeking to be admitted to the organization over China's objections.
This recurs every year. This is not the first time this has happened. It happens every year that the issue of Taiwan is raised in relation to the One China policy. So this is not unusual. The second thing that is not accurate is that Taiwan has been excluded from collaboration and the processes of the WHO. That is not accurate. As I'm talking to you, there are Taiwanese technical experts collaborating with technical experts from all over the world. That has been the case. It was the case with SARS. It was the case with Ebola. It's just always been the situation. The unfortunate thing is that the noise that this has created is creating a political dynamic that really we hope is going to be managed in the traditional way that this is managed.
As the rumour mill swirls with speculation as to the future of Dr. Tedros over his initial handling of the pandemic, the first African to lead the organisation.
The campaign, I think, has been an extraordinary campaign. We've not witnessed anything, I dare say, in the history of multilateralism in recent years, that we get into a global situation where all of us, all countries are supposed to rise together. Instead of rising together, there is blaming, blaming who did this, who did that. It's rather like your house is on fire. Rather than put out the fire, you're searching for maybe the cinder that might have caused the fire. And in the course of that, you're likely to burn yourself.
President Cyril Ramaphosa will address the opening high-level segment along with the leaders of Germany, South Korea and the United Nations. Sherwin Brycepease, SABC News, New York.
And for more on this, let's get some perspective from SABC News Foreign editor Sophie Mokoena, who joins us now on the line. Let's talk about what the ambassador there spoke about, multilateralism, and how COVID-19 has really illuminated the fissures, especially in terms of international relations. President Cyril Ramaphosa will be forced to at least touch on some of these things. Sophie?
Yes, indeed. You are aware that since the election of Donald Trump and other leaders around the world looking at countries such as the United Kingdom, countries such as Brazil, there has been a rise of nationalism. And when they go to these multilateral meetings, they tend to put the interest of their countries first, and the issue of consensus for them doesn't matter. And therefore, as you deal with this pandemic that you have, that is affecting the whole world, and it calls for a united world, unfortunately, you are having those countries that are talking about their own interests and going all out to kind of push their interests first and not playing by the rules of the consensus. And therefore, there's a fear that at the meeting tomorrow, you are likely to see this happening. You know, at the last General Assembly, it was the same issue and of the United Nations in New York in September. So now again, when this kind of world gathering, where you have 119 countries coming together, the delegates talking about the big issue that is this pandemic, even though the meeting is virtual, you are going to see a clash of interest. And we know that currently China and the United States of America don't see eye to eye, because America is accusing China of not divulging information around this coronavirus or the COVID-19, how it has started. And therefore, you have China also defending itself, saying they did. And of course, now the World Health Organization is caught in the middle, where America is accusing the WHO as supporting China. You also have the issue of Taiwan. Taiwan wants to go there as an independent country with the independent delegation. And when you look at the United Nations rules currently, they are operating under one China policy. And therefore, you can't have Taiwan going there as an independent state, as a member state, but Taiwan can go there as part of the delegation from China, mainland China. And they don't see eye to eye. It's impossible. You also have a situation where there's a fight around the vaccine. Who is going to get it right first? And as you get it right, are you going to share this important invention with the entire world? Or is it going to be first come, first serve based on affordability and those who have?
Do you think those proxy wars will play themselves out in the election of the executive board members, which is expected during this World Health Assembly? And of course, the purpose of this is to determine policies for the organization. So the individuals chosen, will they really expose those proxy wars?
There is lobbying already. I think lobbying started last month. I mean, you see leaders talking about how they are engaging in an attempt to discuss the issue of the vaccine and how to approach this crisis. But behind the scenes, the issue of lobbying for candidates is happening. President Ramaphosa yesterday spoke to President of China, Xi Jinping. And now we read that among other issues they talked about was the issue of Taiwan. And you can see lobbying is happening. There's no way Donald Trump didn't call other countries to try and push that they must support America's position. The same with United Kingdom, the same with Germany. Angela Merkel will be delivering a message. I guess every country will try to ensure that whoever becomes part of this important agency of the United Nations that was formed in 1948 after the Second World War, after the formation of the United Nations from the League of Nations, you will have influence at the global level.
Thank you very much. SABC News Foreign Editor Sophie Mokoena speaking about the 73rd World Health Assembly. It starts that's Monday up until the end of Tuesday. It will be virtual but does take place in Geneva. It takes place at a very pivotal time in terms of the global order and a concerted effort as a globe to find commonality in fighting the scourge of COVID-19 and lessening its impact on the peoples of the globe. We'll have more on the impact on economies, on industries, and especially human resources, how companies can handle this. All of this coming up after the break.